Okay, I'm recording this for our attendance. And now I will take a photo. No? Okay, 1, 2, 3. Okay, another one. Last photo. 1, 2, 3. The next topic is about the different types of bleeding. No? So the bleeding sublimation method trademark the different types of bleeding. So we will try to study and we will try to identify what are the different types of bleeding which the woman might experience throughout her reproductive age. No? So let's begin. There are 4 types of bleeding recognized in a woman's chart which are to be considered as normal, no? So meaning, number 1, we have the menstruation, the withdrawal bleed, the breakthrough bleed, and the implantation bleed. So all women of all walks in life would experience the following: menstruation, withdrawal bleed, breakthrough bleed, and the implantation bleeding. Now, let's discuss the following bleeding one by one. So let's start first with menstrual bleeding or menstruation. Okay, huh? So take note, we are studying the 4 different types of bleeding one by one. First, we will study menstruation, then followed by the withdrawal bleed, then breakthrough, and then implantation. So we are now within the menstrual bleeding or menstruation. So let's try to look at the 2 bullet points, no? Regarding the definition of menstruation. So it's written here, menstruation is preceded by a peak. There is an ovulation. So take note. So meaning, menstruation will only commence if there is a successful ovulation. But how you will be able to identify if there is an ovulation? Mucus develops from a sticky sensation ending with a slippery sensation. If mucus will end with a slippery sensation, it means there is a peak day. If there is a peak day, then there is an ovulation. Take note of that. And menstruation will only commence when the hormones estrogen and progesterone gradually drops. It will drop 11 to 16 days after the peak day. Okay, look at this one. Look at the slide rule that I am holding. During the luteal phase, both estrogen and progesterone are high. But progesterone is dominantly higher than estrogen. Okay, huh? So both estrogen and progesterone are high. But take note, progesterone is dominantly higher than estrogen. So during the luteal phase, these 2 hormones are high. It will gradually drop 11 to 16 days after the peak. So the moment progesterone and estrogen drop, then it means menstruation now will commence. So there are 2 things that we need to know about menstruation. Take note, menstruation will only commence if there is a peak day, if there is an ovulation. And you know the definition of a peak day. What is the definition? It is the last day of the slippery sensation. Okay, and slippery sensation is an indication of what? Of the egg ready for ovulation. It means the egg is already mature and any moment there will be an ovulation. So it is happening where? During the days of what? Changing pattern of fertility. Mucus starts to develop from a sticky sensation ending with a slippery. If mucus will end with a slippery sensation, it means there is a peak day. There will be a luteal phase. If there is a peak, if there is a luteal, menstruation will commence. 11 to 16 days after the peak day. And what is the other definition of menstruation? Menstruation is caused by the gradual drop of both estrogen and progesterone during the luteal phase. The moment these two hormones drop, then menstruation now will commence. Clear? So this is the first type of bleeding, which is known to be menstruation. So look at the chart. By looking at the chart, can we say the chart is a normal pattern? We can only identify if the cycle is a normal pattern if you see the mucus developing from a sticky sensation ending with a slippery. Is there a developing pattern? I would like to hear an answer from the class by saying yes or by saying no. You can switch on your microphone. Okay? Can you make an answer? Is this a normal pattern? Yes or no? Or using the chat box?
Yes po.
Yes, thank you so much to all your answers, no? Yes, it is a normal pattern. Look, on day 11, mucus starts to appear. The appearance is cloudy, but the most important is the sensation. It is sticky. Then suddenly, on day 12, the woman is surprised. Why? Because the mucus becomes clear like water. But the appearance again is not that important. The sensation becomes wet at the vulva. And then on the 13th day, on the 14th, the 15th, the 16th, the mucus secretion or sensation is slippery. That is the meaning of a developing pattern. It starts with a sticky, it becomes wet, and it ends with a slippery. And where is the peak day? The peak day is on day 16. Why? Because on the next day, day 17, it is already dry. So absolutely 16 is the last day. The last day is marked with an X, peak day. If it is a peak day, it means there will be a luteal. How long is the luteal? 11 to 16 days. If there is a peak, it means 11 to 16 days, menstruation will commence. Is day 31 a menstruation? The answer is yes. Why menstruation? Because of the following reason. It is preceded by a peak. There is a peak day. And there is a luteal phase. Let us count the luteal phase starting on 17 together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. The luteal phase is 14 days long. Is it within the range? Yes, it is within the range of 11 to 16 days. That is why we can now make a valid conclusion that 31 is a bleeding. What type of bleeding? It is a menstrual bleeding. Is menstruation now clear to all? Can I see a thumbs up or a yes in our chat box? Okay, I will wait for your responses. Thank you, Paz, for your response. Thank you, Vicente. Thank you, Heide. Thank you, Nida. Okay, thank you and thank you, Molari, no, for your responses. So this is menstrual bleeding. Thank you, LV. Okay, and for your responses also in the chat box, no? Okay, let's continue. Okay, so day 31 is menstrual bleeding. Yes, Lailani, you're raising your hand. What's your question? You may switch on your microphone. Lailani. Yes, Lailani.
Wala.
Nothing, sir. Nothing.
Yes.
Doc,
Yes.
Doc.
Yes.
Ito po yung sinasabi minsan ng mga matatanda ng mga bata pa kami na kapag nag-mens ka ng 31 tapos ay di syempre kasunod niyo yung next month, ang tawag po nila ay saklang sa 2 buwan ang pasok ng mens.
Opo. Okay po, no? So, tandaan tama po kayo dyan, no? Yung mga matatanda. But take note of this one, no? This is an average cycle. An average cycle means menstruation will commence before the 35th, no? So, we begin from 1, the entire average cycle is on the 35. So, your menstruation commences before the 35. If your menstruation commences early, maybe day 20, day 18, it means you don't have a BIP. That is a short cycle. Short cycle, this one is an average cycle. If your menstruation will commence beyond the 35 day, we call it a long cycle, no? A long cycle. So clear? Thank you so much for that additional message coming from our ancestors. So, Ma'am Lailani, no? Okay, let's proceed now. Okay. Okay, let me go to the next slide. So, bleeding on day 31 is a menstruation, no? So, take note. The bleeding is preceded by a peak. There's a peak day. A new cycle commences. So, day 31 is a new cycle, the beginning of a new event in the life of the woman. And day 16, take note, is considered to be the peak day. So take note of those things that I marked. These are very essential in the chart. No? Now let's go to a withdrawal bleeding. Now, before I go to the withdrawal bleeding, I'll just give an introductory concept on this one. Take note that withdrawal bleeding is a normal bleeding for those women who are approaching menopausal. And for those women whose age would be what? Between 13 to 18 years old, they might experience a withdrawal bleed, and that will be normal for them. But if you are not within that age bracket, no, 13 to 18, and then maybe 35 and beyond, no? Not a perimenopausal mother, and you experience most of the time a withdrawal bleed, then that would be a sign of abnormality. Okay? So let's try to look what is a withdrawal bleed. Withdrawal bleed, it means it is a sudden drop of estrogen. Okay, take note that estrogen begins to appear, estrogen begins to rise the moment there is already a mucus. And estrogen will be able to reach its highest concentration or peak if mucus will develop into slippery. If mucus will not develop into slippery, it is an indication that your estrogen did not reach the correct or the highest concentration. It drops. How come it drops? Because there is a sign of abnormality. When estrogen rises, the BIP is interrupted. Take note that the BIP will what? Will be interrupted. Why? Because the moment estrogen begins to rise, mucus will start to appear. And then BIP will disappear. No? If ovulation does not occur, it means estrogen did not reach the highest point. Look at the third bullet point. I am already in the third bullet point. If ovulation does not occur, it means mucus did not end with a slippery sensation. If mucus will not end in slippery, it means estrogen drops. And then what will happen to the lining? The lining of the endometrium will be what? Will be unsupported. It will be dislodged, causing now a withdrawal bleeding. I repeat, withdrawal bleeding is very common to those women or to those girls at the age of puberty. Until maybe 18 years old, they might experience withdrawal bleed, which is a normal pattern, including those women approaching menopausal, maybe 35 years and beyond, no? sometimes early, 30 years old and beyond. But if you don't belong to those bracket and you experience most of the time a withdrawal bleeding, it is a sign of abnormality which requires medical attention. Okay? Let me give you an example of a withdrawal bleed. Let's go to the chart day by day. I want you to focus your attention. Okay? Day 1, day 2, day 3, day 4, day 5, day 6, day 7. These are all dry days. I would like to ask you, by switching on your microphone, I need to have an answer. What kind of dry days are the following? Day 1 to day 7. There are two types of dry. Take note, there are two types of dry. BIP and then luteal. Is day 1 to day 7 BIP or luteal?
BIP?
Very good,
Yeah.
BIP. Why BIP? Because we don't see a peak. If we have a peak, then we will have a luteal. But
Yes.
before day 1, we don't see anything. So day 1 to day 7, these are the days of the BIP. If these are BIP, what kind of rule we can follow? Anybody? If you want,
DDR2.
what? Pass?
DDR2.
Very good. Pass, Lian, and Joy. EDR2. You can have intercourse on day 1, then followed by day 3, followed by day 5, and day 7. On day 8, BIP is interrupted. Why? Because there is a mucus and the sensation is wet. If there is a mucus, estrogen is rising. But look what happens on day 8. On day 8, mucus did not develop. There is no developing pattern. Developing pattern means mucus starts with a sticky sensation. It will become wet. It will end with slippery. So day 8 is the last day of mucus. Why last day? Because day 9 is already dry. But we don't put an X. Why? Because there is no ovulation, no peak day. Now I repeat, if you don't have an ovulation, absolutely, you don't have a luteal. So day 9, day 10, day 11, day 12, we call this the return of the BIP. BIP returns. Kailangan, dapat pa nagkaroon ng mucus, if there will be mucus, then tapos na ang BIP. Why? Because mucus will become slippery and then you will have a luteal. But the problem is, the mucus did not develop. No peak, no luteal, BIP returns. Now, how come we need to count 1, 2, 3? Day 9, 1. Day 10, 2. Day 11, 3. Why? Because after mucus, whether the mucus will end with a slippery or if mucus will not end in slippery, after mucus, it takes time for the cervix to be completely closed by the G-plug mucus. So day 9, day 10, day 11, cervix is still open. Cervix is closed on day 12. The couple can have intercourse on day 12, but they cannot apply the peak rule every day at any time because day 12 is a BIP. Return of the BIP. If it is BIP, what is the rule? At night, intercourse is available at night and it should be alternate evenings, EDR2. Then surprisingly, on day 13, again, there is a what? There is a mucus secretion. 13 wet, 14 wet with a blood. I will explain the bleeding later, no? So it means day 14, day 13 and 14, there is mucus. But look again. The mucus did not develop into the 3 stages. Sticky, becoming wet, ending with a slippery. On day 15, dry. Day 15 means the return of the BIP. It's again BIP. We don't mark an X on day 14 because day 14 is the last day of mucus, but not the last day of slippery sensation. 14 is not a peak day. No peak. Why? Because mucus did not develop into what? From a sticky into a slippery sensation. Day 15, BIP returns. But the moment the BIP returns, we need to allot 3 days of BIP because the cervix requires 3 days to be completely closed after mucus. 15, day 1. 16, 2. 17, 3. 18, the cervix is completely closed. But because it is not luteal, no? It is the return of the BIP. What is the rule during the days of BIP? EDR2. Intercourse is available on day 18 at night. If intercourse will take place at night on day 18, abstain on day 19 because alternate evenings. Now look at your day 20. Again, the woman is surprised. Mucus starts to appear on day 20. The sensation is sticky. 21, mucus appear. The sensation is sticky. 22, mucus is sticky. 23, mucus is sticky. 24, mucus is sticky. 25, mucus is sticky. 20 to 25, there is no developing pattern. Mucus is stagnant. It is always sticky. It did not become wet. It did not end with a slippery. 25 is the last day of mucus. No X because it is not the last day of slippery sensation. Day 26, BIP returns. No? There is no luteal phase. We need to count 1, 2, 3 in order for us to be sure that the cervix is completely closed. On day 29, EDR2 can be applied. Intercourse is available at night and it should be alternate evenings. If intercourse happens on day 29 at night, no intercourse on 30. But if there will be no intercourse on day 29, intercourse can be resumed on day 30 at night. This is an example of an irregular pattern. What is an irregular pattern? When mucus starts to appear, it will not develop into a slippery sensation. The most important part here in the chart, I need your attention, is day 31, 32, 33. There is a bleeding. Those women with no knowledge of the Billings ovulation method, they will think that 31, 32, 33 is a menstruation. It is not. Because you know the definition of a menstruation. Menstruation commences 11 to 16 days after the peak day, ovulation. There is no peak. We call it withdrawal bleeding. A withdrawal bleeding is the sudden drop of estrogen. When estrogen drops, mucus will not end in slippery. No peak, no ovulation. If this type of bleeding will always happen every month, you are experiencing a withdrawal bleeding. That is a sign of abnormality. Why? Because a withdrawal bleeding is an indication of hormonal imbalance. If you have withdrawal bleeding, it means your estrogen is not reaching the highest point. And if you don't have a what? If you have a withdrawal bleeding, you don't have luteal. If you don't have luteal, meaning your body is not experiencing what? The high movement of progesterone. Your progesterone is not appearing inside your body. If you are experiencing withdrawal bleed, you don't have progesterone. Your estrogen is dropping. And what do you call that? These are what we call what? Hormonal imbalance. No? Hormonal imbalance is only experienced by perimenopausal mothers, those young ladies, no, aging from what? From puberty, maybe 13 or 10 or 11 until 18 years old. If you are experiencing withdrawal bleeding and you are not a perimenopausal and you are not a teenager, no, until 18, there is a problem. You might have polycystic ovarian syndrome. You might have myoma and or any other abnormalities in your body. 31, 32, 33 is a withdrawal bleeding. Attention, all participants. Take note that after menstruation, the cervix is completely closed. But after withdrawal bleeding, the cervix is still open, no? When BIP returns. That is why we need to count 1, 2, 3 after a withdrawal bleeding, because cervix will be completely closed on the 4th day of the BIP. Not like menstruation. Menstruation, I will open so that you can see me in your camera. After menstruation, the cervix is completely closed, the BIP. But after a withdrawal bleeding, the BIP, no, is still what? The cervix is still open. It requires 3 days. Allow 3 days of BIP. On the 4th day of the BIP, you apply the EDR2, which is alternate evenings. Again, this is a withdrawal bleeding. Let me check. So 31, 32, 33 is not menstruation. It is a sign of abnormality that requires medical attention if you are not a perimenopausal mother or a breastfeeding mother, or what we call, if you are not within the teenage years, no? It requires medical attention. But it is a withdrawal of estrogen bleed. In short, withdrawal bleeding. In medicine, they try to name it completely, no? Withdrawal of estrogen bleed. Why? Because the cause of withdrawal bleeding is the sudden drop of estrogen. Estrogen did not reach its highest point. Bakit? Why? Because of certain abnormality. Okay? So now let's go to the next one, the breakthrough bleeding. The breakthrough bleeding is the opposite of the withdrawal bleed. It is what? It is due to high level of estrogen. No? Prior to ovulation, take note of prior to ovulation. Withdrawal bleeding can never happen during the day of ovulation, but it can take place before ovulation. This is normal, nothing to worry. No? It is a normal pattern. Okay? Day 14 is a Day 14 is a breakthrough bleeding. How would you know if you have a breakthrough bleeding? If your mucus has spotting. So if you have a mucus and you see spots of blood, that is what? A breakthrough bleeding. Similar to this chart. Day 14 is a what? A breakthrough bleeding. Day 31, 32, 33 is a withdrawal bleeding. It can happen in one chart. You will have a breakthrough and you will have a withdrawal bleed. But take note, a breakthrough bleeding is a normal thing, no? Nothing to worry. Okay, look at this one. The breakthrough bleeding happens on day 16 prior to ovulation on day 17. So 16, you notice there is a mucus, it is slippery, and there are spots, no? Spotting within mucus secretion is a sign of a breakthrough bleeding. Take note, it can never happen during the day of ovulation. The spots with mucus can only take place prior to ovulation. This is a withdrawal bleeding. This is a breakthrough bleeding. I repeat, this is a breakthrough bleeding, day 16. No? Now, what is an implantation bleeding? The last type of bleeding. An implantation bleeding can happen in some pregnancies. It can happen 6 to 12 days after conception. So if you have an intercourse and then the sperm was able to meet the egg and there is an implantation pregnancy, then 6 to 12 days after conception, after the meeting of the egg and the sperm, there will be a bleeding. And some women will be surprised, oh, I have a menstruation. It means I am not pregnant. Then after a month, they are surprised. They're what? These women are what? Pregnant, no? It can be spotting or a heavy bleeding. And take note, sometimes women confuse this with menstruation. That's why they announce to their husband, I am not pregnant, so don't worry because I have a bleeding now. Without knowing that that bleeding is a what? An implantation bleed. And then after 2 months, the wife would say to the husband, I'm sorry, but I am pregnant. But you told me you are what? You had mens. So how come you are pregnant now? Maybe it's not mine, no? So if couples are not educated about the different types of bleeding, it might cause chaos, no? So look at this one. Okay, look at this one. Okay, let me drag this one, no? So implantation bleed. It can be spotting or heavy bleeding and confused with menstruation. Okay, look at this. Look at the one below, no? Intercourse take place on days 15 and 16, no? So there is no symbol of I on day 15 and 16. That is why it is placed at the bottom for us to know. There is an intercourse on days 15 and 16. Day 15, open cervix. Day 16, peak day. It means what? Ovulation is taking place. I would like to ask our participant, if intercourse take place on day 15 and day 16, answer this with yes or no. Do you think there will be pregnancy?
Yes.
Yes, because that is a developing pattern, no? Developing pattern, there is a peak. So if there will be an intercourse on day 15 and day 16, automatic there will be what? There will be what? Pregnancy because there is an ovulation on day 16. But now the couple, no? The woman told the husband, no? The wife told the husband, I have a menstrual bleeding now, 25, 26. So we are lucky. Okay, so 25 and 26, bleeding. But 25 and 26 is not a menstrual bleeding. It is an implantation bleed. Why? Because the moment the sperm fertilized the egg, the moment the fertilized egg or the baby, no, implants along the lining of the endometrium, sometimes due to high friction, some of the lining of the endometrium will be dislodged and it will be seen now as a bleeding. And women now will be confused because most of them, they think that this is menstruation. And without knowing, after 2 weeks, no, and during the pregnancy test, no, and maybe after a month, no, the woman now is surprised. Oh, I am positive, no, pregnant. And of course, it will create confusion. How come I turned to be pregnant if I saw menstrual bleeding last 25th and 26th? But now, because of an education, no, regarding the 4 types of bleeding, I think when you now handle instruction to women, no, especially couples, you can tell them that there are 4 types of bleeding. And one of them is the one that we are discussing right now, which is the implantation bleeding. And implantation bleeding is an indication that the mother, the wife, the woman is pregnant. Clear? So this is what we called the 4 types of bleeding. And the one that you are seeing right now is an implantation bleeding due to the intercourse that took place on days 15 and 16, wherein these days are known to be fertile days and 16 is known to be the peak day, the day of ovulation. So these are the 4 types of bleeding. You have your menstruation, the withdrawal bleed, you have the breakthrough bleeding, and then you have the implantation bleed. The one that needs attention is the withdrawal bleeding. No? If your age is not within the following, age of perimenopausal and teenage year age, no, and you are experiencing withdrawal bleeding, it is a sign of hormonal imbalance. And what is the cause of the hormonal imbalance? Maybe due to the polycystic ovarian syndrome or any other diseases related to the reproductive system. Okay, do you have any questions before we proceed to our last topic for today?